Hello, you guys. I'm Dr. Vidal. We are here at Pure Plastic Surgery, and we are back with Tuesday Tips. This is our weekly check-in. We discuss different topics of plastic surgery, and I get to answer your questions. Thank you guys for joining and for sending me different topics that you'd like me to discuss. And today we're going to be talking about myths and misconceptions in plastic surgery. Plastic surgery is a field that it's very popular, and in social media, it's getting more and more popular in all group ages, and it tends to have some myths and misconceptions. When a topic gets so popular, there's a lot of people that tend to be talking about it, and not always talking with factual and evidence, talking about experiences, and that may lead to myths and misconceptions. There's a lot more than just this 5, but this 5 I found in the website of the American Society of Plastic Surgeons. That is a great source of education that the patients can go into and find information in different topics. The society, ASPS is the short version of it. American Society of Plastic Surgeons only accompanies the board certified plastic surgeons in the US and internationally too. So it's a very good source if you want to know more about any specific surgery, and also if you want to find if your surgeon is board certified or not. So this 5 myths and misconceptions I found in the website, and I want to go over and discuss a little bit and talk about this 5 topics here. So number 5 is plastic surgery is all about beauty and vanity. And that is not true. Plastic surgery is a specialty that focuses on a form and function. And aesthetics is a part of plastic surgery, and in a very popular and strong part. But there are also other forms of plastic surgery or other procedures involved. Reconstructive surgery, burn surgery, pediatric plastic surgery, repairing cleft lips and palate for kids, craniosynostosis or malformations of the head and neck, and trauma reconstruction. So there is a very broad field. Hand surgery is also included in plastic surgery. So it's not all about beauty and vanity. And in the aesthetic world, which is mainly what I do, it's not all about beauty and vanity. There's a lot of restoring. So when we're talking about massive weight loss, post-pregnancy changes in your body, aging changes, there's a lot of restoring and going back to the whatever it is, pre-weight loss, pre-pregnancy, aging, right? And restoring that confidence and body shape and form. So I think it's a lot more than vanity, right? I see it in my patients. I see it in myself because as you may know or not, I've done some procedures, and I do Botox, I do fillers, and it's not only vanity, it's maintaining and aging appropriately and feeling more confident in your own skin. So it has to do a lot more than just beauty and vanity. Number 4, plastic surgery is only for the rich and famous. That is not true. Although rich and famous do a little bit of plastic surgery, of course, but majority of the patients are regular patients like you and me, right? Moms, working dads, like your sister, your neighbor. Those are the ones that are seeking majority of procedures in plastic surgery. And we go back to what I was talking about, right? Regaining your confidence, feeling better in your own skin, and enjoying your body and your life. It doesn't matter if you're 30, if you're 50, if you're 70, okay? Plastic surgery is only for women. That is not true. It's a myth. Plastic surgery is for everyone. And we're seeing more and more as trends and popularity is changing, and also perspectives. So we might think that a male shouldn't be doing anything like vain or changing anything in their face or aging. It's different, or you see it, and that is changing a lot, and for the good. There's something, or there's a trend called Botox, which is Botox for men, and that is, you're not feminine, or you're not less than a man if you decide to do that. Not at all. It's just, again, preserving your face, facial wrinkles, trying to avoid or age appropriately, and try to look yourself a little better and prevent the wrinkles in your forehead, around your eyes. Fillers for men is also an area that is getting more and more popular, for the jawline, for the cheekbones, trying to define more structures. And the fillers and Botox doesn't have to change your face to a more feminine face. Not at all. It's preserving your masculinity, but also aging more gracefully. And what are the most common procedures that I do in male? It's gynecomastia and liposuction. So gynecomastia is by far the most common procedure. It's removing excess breast tissue or skin in the chest to get a more tightened or masculine appearance of the chest. And that procedure can be done in different ways, depending on what is it that that is causing the discomfort or to improve the aesthetics of the chest. Is if it's just breast tissue and fat, then maybe just liposuction, it's good for you. Sometimes you need to do a small incision around the areola. It's called a periareolar direct excision of the breast tissue, and or if you have excess skin, that it may need a actual skin excision and repositioning of that areola for better contouring. So there are different options depending on what is that the anatomy that you have. And liposuction, the most common is a lipo 360, and I see a lot of ab etching in male patients to define more of the abdominal muscles and to get a more athletic look. Okay. Number 2, plastic surgery has no scars and lasts forever. I wish. Unfortunately, this is not true, right? We're talking about plastic surgery, not magic. And unfortunately, there are scars involved, and the forever part, we'll talk a little bit about that. So let's start with the scars. Even though there are scars involved because it's surgery, plastic surgeons will try to minimize the scars, hide the scars in areas that are not shown or less or more able to be covered with clothing or bathing suits. And also the suturing involved is a more delicate suturing, so the scars heal better. And which is one of my priorities. Like I'm very prominent with my patients explaining the scar treatment afterwards. And I think that's extremely important, because I can try my best and suture as pretty, as thin as possible, but if you're not thorough and follow up on your scar treatments, then those scars can get thick and dark. Okay, so it's a combination of things to try to get those scars to be as thin, as clear as possible, and the localization or the placement of the scars to be in areas where we can hide them very easily. Okay, so even though it's not no scars, but minimal scars and scars that are easily hideable. Okay, and forever, well, nothing lasts forever. Okay, so aging is going to get a toll. It's going to change your body. It's going to change the shape of things, the breast, the buttock, the skin quality changes. But what can we do to try to long or stretch those results as much as possible? Your health, it's important to keep a healthy diet, to keep your active life, so you maintain those results. If you strengthen your muscles, if you eat balanced, if you stay hydrated, if you protect your skin from photo aging, which is sun exposure. So all of those things are extremely important, and not only for surgery, but also to minimize your aging throughout. What are the things that increase or worsen your aging? One is fluctuations in weight gain and loss. That's going to stretch your skin and the quality of the skin changes. Two, SPF or sun protection, okay? The sun causes photo aging, or the skin gets damaged with prolonged exposure, and that's going to cause your skin to get thinner, to get more brittle, fine lines, and the appearance of aging. And the other thing is smoking. So if you're a smoker, smoking is going to affect and create a more drastic aging changes in your skin. So consider quitting smoking, increase your healthy lifestyles, balanced diet, exercise, hydration, and that's going to preserve, it's not going to last forever, but it's going to preserve your results in the long term. And number one, a plastic surgeon is the same as a cosmetic surgeon. That is not true, okay? These two are not the same, and it's important to understand, and I'll explain the difference between these two. Plastic surgeon is a specialty, like I said, focused in form, reestablishing form and function. And it's a specialty that you have to be in training after med school for at least 6 to 8 years before becoming a plastic surgeon, okay? For me, it was a total of 9 years, sorry, because I did a fellowship in burn and reconstructive surgery. So I did 5 years of general surgery, a year of burn and reconstructive surgery in New York City, and then 3 years of plastic surgery subspecialty. So it's a total of 9 years of training and surgery. So even though like I started at Pure, I've been operating and doing surgeries for 9 years before. After that, you take your diploma as a plastic surgeon, and then you start your board certification process. The board certification in plastic surgery is a very rigorous and strict process that takes up to 2 years. The reason for that is because you have to take all the cases you do for a year, send them to the Board of Plastic Surgery, the American Board of Plastic Surgery. They evaluate the entire list of cases. Of all those cases, after they evaluate the list, then they say, yes, you're good to take the exam. Once you get the you're good to take the exam, they tell you what 5 cases are going to be examined. And of those 5 cases taken random from your list, I have to submit every single paper, picture, operative report, labs, everything that I did with those 5 patients, and they evaluate strictly my judgment, my ethical behavior, my results. So it's a very strict process. So to go to a board certified plastic surgeon, what that tells you, that that person is well trained, that it has experience in what's doing, okay? That we have good judgment, ethical behavior, and that our priority is to keeping our patients safe, okay? So all of those things, which are extremely important. And what's a cosmetic surgeon? Isn't the same thing? A cosmetic surgeon is not. A cosmetic surgeon, it's any doctor, anyone that decides to do a 1 year, we're not talking about 6 to 8, or in my case, 9 years, 1 year of training, and they get to get the board of the American Cosmetic Surgeons. So there's something called the American Board of Medical Specialties, right? And this is the entity that reviews all the boards. The board of obstetrics, the board of family medicine, internal medicine, every single board, and qualifies if it's an actual specialty, 1, and 2, if the rigorous process that I explained for plastic surgery, it's valid. And the American Board of Cosmetic Surgery, it's not included in this American Board of Medical Specialties. Why is that? Because the American Board of Cosmetic Surgery, it's not as rigorous, and it does not involve the training that the plastic surgeons go through, okay? So even though it's like, if I want to create a board, I can say, I'm board certified in the liposuction, or I'm board certified. But if it's not verified by the American Board of Medical Specialties, then it's not an actual specialty of medicine. Okay? And even though the cosmetic board of medicine or the board of cosmetic surgery or whatever they want to call it, it's it's there, right? It's in, you can Google it, it's there. It's not certified and backed up by the American Board of Medical Specialties, okay? Which plastic surgery it is, okay? So just be very careful, because if you go to a cosmetic surgeon, they are not well trained and they are not certified in the rigorous process that plastic surgeons are. Okay, so it's not the same thing, and it's just to keep you safe, right? If you are going and trust the surgeon that is going to do your procedure, you have to verify their credentials and their training to be safe and to return home to your family safely. Okay, so those are the 5 myths. I'll take some questions now.
Well, we have so great messages.
Okay.
Important questions. First of all, I'm so happy with my decision. You're a great surgeon, Doc, and a human being. I feel that I was in good hands.
That's great. I love it. Thank you.
Another one says the whole team is amazing. Love you all. Thank you, Doc.
Awesome. Thank you.
Okay. Since I'm no longer on medication and I'm 3 weeks post-op, is it
Really? It's not.
It's okay to have a glass of wine now?
Yes, it's okay to have a glass of wine. Remember that the reason why it's not good to be drinking after your surgery. One is obviously what you mentioned, right? The narcotics mixed up with your alcohol, not a good idea. Okay, so if you're still requiring narcotic medications or any medication for your pain, you shouldn't be mixing it with alcohol. And the other reason is the swelling. Okay, so you can have your glass of wine, but don't go crazy. Okay, if you drink a lot, the whole bottle, then you're going to be very swollen the next day. Okay, because alcohol, like the hangover, gives you swelling. Okay, and if you are post-surgery, that inflammation is still there, okay? So enjoy your glass of wine, but take it easy.
I'm scheduled for a leave, and I'm nervous about the scars only because I keloid.
Okay. Yes, that's a very authentic and a very common concern, especially in people that keloid. One of the things that we're going to do to minimize scarring is like I was talking earlier, right? The position of the scars. Okay, so the scar around the areola is hidden very well because of the change of pigmentation, and the one in the bottom, it's hidden in the fold, so that one it's very easily hidden. The one in the middle is the only one, and usually is the area that heals the best in breast surgery, because the skin is very thin in that area and tends to heal very nicely. Okay. Other than that is your treatment post-op, okay? So you are going to try to minimize tension in the scars, okay? So call it T-Rex arms. Try to keep your arms or your elbows close to your body the first 2 weeks to avoid stretching and tension on the incisions. And then at 2 weeks, you're going to start scar treatment. The one that I recommend is silicone-based scar products, okay? Those are the ones that are FDA approved to improve the appearance of scars with time. It's something that it's not gonna work from one day to the other. It's something that you have to do every day for at least 3 months to see a difference, but it does work, okay? And if you do end up getting hypertrophic or keloid scars, then we can start talking about other early interventions to decrease the progression and decrease the worsening of symptoms.
I'm 3 weeks post-op from my mom makeover with you.
Awesome.
And I have been getting a massage.
Okay.
Today, I literally cried happy tears seeing myself. You're an awesome surgeon.
Aw, I love it. Thank you so much for sharing that. And I love to hear that story, because when we go back to this one, that tells me it's not that feeling of seeing yourself in the mirror and seeing and being happy and more confident in one's own skin. That's what it's all about.
Once you're 5 days post-op from a tummy tuck,
yeah,
is it best after a shower to dry the belly button and let it heal on its own, or is best to use an ointment?
So after 5 days, you can put ointment or you can let it dry. At that point, it's probably well healed. If you're still a little moist or you see sometimes the stitches kind of dissolve at that point and you see any opening, you can put some antibiotic ointment there. But it's okay to just pat dry it and clean it. And then you're going to start the scar treatment at 2 weeks post-op.
Is face tight better than chin lipo?
So they're different, right? Okay, so chin liposuction takes care of the subcutaneous fat, okay? So if you pinch, that thickness is the one that we're gonna decrease with the chin lipo. The skin laxity, it's gonna be improved with the face tight, okay? So they're similar, but they work two different things, okay? So if you have a combination of excess fat and excess skin, then it's better to do both. For younger patients that just have excess fat but no skin laxity, I would say their 20s, then chin lipo it's good to do alone. But usually after 30s and 40s, it's better to add the face type because the neck skin is very thin and it usually doesn't contract very well. So with chin lipo, usually you can get a little sagging of the skin down there. So it's better to combine it with face type.
Do you do rhinoplasty?
I do rhinoplasties. Rhinoplasties are a great procedure for the dorsal hump, or when you're looking in your to the side and you have a prominent dorsal hump there. You can thin that. The dorsal aesthetic lines, which are the two lines that go from your eyes to the tip of your nose, can be thinned down. And also working on your tip, it's a very drastic change that you can refine it. We can elevate it a little. Sometimes it's droopy, especially on that side view, and we can bring some stitches on the inside and make it more thin and more projected to give you a better appearance of the nose.
My belly button looks a little shriveled after my BBL. I also had a tummy tuck last year.
Okay.
Will it go back to normal?
So depends on how early post-op you are. So the belly button is a fixed point in our abdomen, and sometimes with liposuction, even though I'm not changing the belly button, if the skin is lax around it, it may hood a little bit over the belly button. What are the things that we can do, the massages, to try to get that skin to retract upwards? When you're putting the foams on, try to bring the skin up and then put the foam, and that's going to help the skin retract upwards instead of pulling it down and causing more hooding of that skin. And also you can try belly button shaping, which is putting either a marble or a silicone ball inside. If you go in Amazon and put just belly button shapers, you'll find a lot of options. They come in different sizes depending on your anatomy, and basically putting that plug there to try to get the scar to heal as round and not like a line or more flat. Awesome. Thank you guys for all the questions. I hope all these misconceptions were cleared and you understand, especially this one. I do it so you guys are safe and you can return to your families safely. If you have any questions, you can DM me, and I'll see you guys next week on Tuesday Tips. See ya.